infection. When it stays for a long time, it can lead to hepatocellular carcinoma. And another is HPV vaccine. HPV vaccine contracted can lead to cervical cancer, and it is very much well documented. And another benefit is that the mass immunization is a known strategy to contain, control, and eliminate disease. This is the example of COVID-19 vaccine, which has definitely will agree that it has contained the somewhat the corona pandemic. One of the important aspect of maternal immunization is the adult immunization is maternal immunization. Maternal immunization, it protects both mother and baby, and hence bridges both childhood and adult vaccination. It passively transfers the antibody to the neonate. Thus, it protects the tetanus pertussis. And elimination of the maternal and neonatal tetanus is one of the most successful maternal immunization protocols. Immunization for international travelers. Now people are moving to different countries for various reasons. For many reasons, for job purposes, for treatment purposes, there are many reasons they are moving very much to the international travelers. So travelers visiting other countries, there is a potential risk for contracting some of the infectious diseases, and recommendations depend on the region, country which they are visiting, and their duration of trip and the nature of conditions of the travel. One known important vaccine we all know, that is the yellow fever vaccine, then oral poliovirus vaccine, and there are many other vaccines which are recommended for international travelers. And recently, the travelers who are going to some university for their further studies, they have to take specified vaccinations which are being laid down particularly by that university only. Now, there are the challenges of the adult vaccination. So there are lack of knowledge, both the patients and the providers. And I will give you some example that the provider, they are giving the vaccine without knowing the in-depth knowledge of the vaccination. And their prescriber also, they are writing the vaccines which are not matching with the recommended vaccination schedule. So there is a lack of knowledge for both on the patients and also the providers and also the prescribers in some places. And there is a poor public health and private infrastructure for vaccine delivery. Really, there is a country-specific immunization schedule, although the CDC has come with a definite immunization schedule for routine immunization of adults and as well as for the disease conditions. But actually, country-specific immunization schedule is still lacking. And one forbidden thing is the high cost of the vaccine. You know that the HPV vaccine, which is nonavalent vaccine, is costing 10,000 rupees in India. So it is really a very much unaffordable for the, at least for the many of the public. And lack of availability of the vaccine, sometimes it causes problem for the proper adult immunization. So it will help the vaccine manufacturers will come up with great zeal so that they can manufacture more and more vaccines to cater such a huge amount of adult population. So what should be the guidelines for the immunization practice standards in adult population? It involves a lot of processes whom to vaccinate. Because adult population whom to vaccinate, these are selective. They will need the selective vaccines. Not all vaccines to be administered to each age group of the vaccine. So it will be selected. Some vaccines will be administered to some and some will not be administered to others. Like the elderly will get the pneumococcal vaccine, and influenza vaccine can be given in high risk group who are getting the spleen operation, that is before splenectomy. They have to be given to the meningococcal conjugate vaccine, pneumococcal vaccine, and hip vaccine. So it involves the disease process for which they are getting the vaccine, and the age, and there are a lot of other factors also. The next problem is where to vaccinate. There comes the question of adult vaccination clinic. Where to we, lot of providers, lot of the beneficiaries, they move from here to here to there, that where to get these vaccines. So that is really a problem. There should be some designated adult vaccination clinic. Now we have to establish in this World Congress so that people have got knowledge that where they can get the vaccination. Next important thing is to assess the vaccine contraindications and precautions, and we have to provide the vaccine information statements to them, ensuring that the appropriate storage and handling of the vaccines are to be maintained properly. We know that if the vaccines are not maintained in proper cold chain, the vaccine efficacy will be lost and the vaccine will not work. Last but not the least is the reporting of the AEFI, adverse event following immunization. Many a time I have seen that they have faced with some, the provider knows that this is a AEFI, but they fear to report it. They said that, no, I will be caught. It is not that. We want to know what are the events has been followed after the vaccination. It has to be investigated whether actually it is due to the vaccine or not. In that case, if it is a new vaccine, we have to take proper precaution, whether we have to continue the vaccine or you have to disrupt the vaccine. So there are, but the adult, this is AEFI reporting very, 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 very poor. I do not know, at least in our country. So adult vaccination clinic has to be established. It is now well understood thing. Then whether it is individual or in the community level, on which factor it is, what are the determining factors? Vaccination in public health is done in the best interest of the community. It is done usually in the government program, as we have seen in the this corona vaccine. And goal is to control the health of infectious diseases. Then how to improve the adult immunization? We have to create awareness, not only amongst the beneficiaries, but amongst the provider also. We have to highlight the burden of the vaccine preventable diseases. And we have to summarize the vaccine recommendation. What is the vaccine recommendation in our country? Our Indian society has come out with some recommendation, but that is not very clear. It should be very clear, and it should be there should be some one specific recommendation in each country. So we have to find out some solutions. How can we solve all these problems? So in this Congress, we'll find out some solutions. So we'll discuss in some other forum. So to summarize, adult vaccination is a promising strategy for improving quality of life by reducing the health consequences of the vaccine preventable diseases, waning immunity from childhood vaccines, change in target age groups for many vaccine preventable diseases, extensive travel, stressful lifestyles, and neglect of prevention has led to the increasing burden of BPD amongst adults. Thank you so much.
Thank you very much, Dr. Reena Ghosh, for enlightening us about basically on the Indian perspective and the creating about the awareness and the need of the Indian immunization policies. This was a really very good narrative and insight of what best we are doing and what better we can do in the coming times. You have very nicely spoken about the burden of the disease of on in the Indian data, which is, I think, and as you rightly said, is still incomplete, which will have a great impact on the health care impact and the economic impact on the society as well. You very rightly enlightened us about the maternal immunization, and you have very clearly advised about what are the diseases which should be taken care of, about traveling when you are traveling, especially the traveling advisory to the people of high risk group, elderly people, and especially with who carry high risk challenges. You have also spoken about the challenges, about basically the lack of knowledge and the place where you can get the immunization. Thank you very much, ma'am, for enlightening us, especially the Indian narrative, where we lack, what are the weaknesses and what are the strengths. Thank you very much for the time given and the enlightening lecture given by you. Over to Dr. Devadatta.
Thank you, ma'am. It was a very elaborate session and we got a lot to learn from it, especially the parts which you emphasized on the adult immunization clinic. Thank you, sir. Thank you, Tanuraj Shiroi, sir. Thank you, ma'am. Thank you. I would like to proceed on with the next session. The next session was to be, the speaker has not yet arrived, and we have to postpone the next session. So we are continuing with the next session, that is the panel discussion. And I would like to hand over the proceedings to Dr. Ribhu Basu, an eminent public health specialist and associate professor of community medicine, Bankura Shammilani Medical College and Hospital, to moderate the panel discussion on bare minimum vaccines for adults.
Hello, Dr. Ribhu Basu is here.
Good morning. Good evening, everyone. Thank you, Dr. Haldar, for introducing me. So now I would like to request or invite our chairperson, Prashanta Kormakar sir, to please start the proceedings of the panel discussion. Prashanta sir, please.
Thank you, Dr. Ribhu Basu. Am I audible?
Yes, sir.
Yeah. So now we have come to a very important session, that is panel discussion, and that is on bare minimum vaccines for adults. So really, we are still far away from to reach our goal. So far, adult immunization is concerned, and here we are having so many important dignitaries, so many important names in our panelists, and I like to invite them, and I will hand over the to a moderator, ultimately Dr. Ribhu Basu, to take up the questions, to put questions to our panelists. So we do have very important personalities like Dr. Dibyendu Banerjee and Dr. Indrajit Tiwari, Dr. Pranit Ghosh, Dr. Anup Kakureja. Dr. Dibyendu Banerjee, please. Are you here?
Yeah. Good evening.
Yeah. Good evening, sir, for making time to be present over here. And Dr. Harivansh Chopra. Dr. Harivansh Chopra, are you here?
Good evening. Good evening. I am here.
Good evening, sir. Good evening. And Dr. Indrajit Tiwari.
Yeah. Good evening, everybody. Good evening, everybody.
Good
I am
evening,
here.
sir. Good evening. And Dr. Pranit Ghosh.
Yeah, good evening. Yeah.
Good evening, sir. And Dr. Anit Kukreja.
Sir, Kukreja sir, due to some urgent matters, cannot come today. Okay, so we shall be doing the panel with 4 speakers. Okay, sir.
Okay, only 4 panelists we do have. So I like to invite Dr. Riva Basu, who is Associate Professor in Bankura Sammelani Medical College, and he's one of the important person who is having keen interest in adult immunizations, and he has many national and publications in national and international journals.